Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I am very, very pleased to welcome Heretha Hankins out of Georgia, USA. And Heretha is an experienced nurse, and she believes that the nurses own the greatest collective knowledge of the human condition and have the answers for almost anything. I agree with you there. And she says that in her seasoned career, she has worked from bedside to the conference room table, from the student desk to the writer's desk. And she strives to leave a legacy for the next generation of nurses to be better and do more to improve healthcare as an industry while maintaining the core of the profession's inception. She believes that skills can be learned, but compassion comes from the soul. So, welcome, 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 Heretha.
Thank you. Thank you so much. I appreciate that.
My pleasure. So, tell me first of all, what brought you to nursing?
Well, I'm actually a third generation. I have an aunt and a great aunt that were before me that were both
Mhm.
nurses. And my great aunt believed in my family, I guess I should say, believed in speaking into your future. And so myself, my siblings, my cousins were all kind of told what we were going to do as we were getting older. And so I was selected as you're going to be a nurse. They seen something in me and made the decision that that was going to work out really well. And so, as early as 8 years old, third grade, my mother used to always have this paper. She may still have it. I don't even know. But it was what do you want to be when you grow up? You know how they have you write those papers in
Yeah.
school. And in that paper, which I've read multiple times as an adult, I wrote down that I was going to be a nurse that worked with babies, that I was going to take care of people and make sure that the children were being able to be healthy. And, I went on and on to just talk about how sick kids should never be sick and that they should be able to live happy, healthy lives. And so, very early on, it was implanted in me that this was going to be my profession. So, here I sit.
So having so you had the examples of your aunt and your great aunt, right?
Correct.
And then you had the infusion of this into you over and over and over again. But when you became a nurse, was
Mhm.
it what you had in mind?
Absolutely. Absolutely. So I matriculated this profession starting out as a candy striper in the hospitals. And so I was 11, 12 years old and going in, candy stripers didn't really get to do direct patient care. We passed out magazines and coffee and talked to
Mhm.
the older people that were lonely and, sang songs with them, things of that nature. But it was that connection with people that really spoke to me and being able to meet them in their time of need and offer something so small that they thought was so great. And it really fed me, and I really enjoyed it and absolutely loved going to work as a volunteer, right? They weren't even paying
Hmm.
me for that. So here
Exactly.
I am, 11, 12 years old, putting on my little candy striper suit and so happy to go in just to be able to have those moments with those patients. It fed my soul then. And so I immediately, when I left high school, went in to go be an LPN. It was the quickest and easiest way for me to be able to get into
Yeah.
nursing. I was a maternal, I was a mental health professional. And so I had worked in the mental health field just as a staff member, not as a nurse, and making sure that they were staying safe as I went through school to become an LPN. So I became an LPN and immediately went into long-term care pediatrics, and then went back and got my associate and went back and got my master's and went back and got another master's. And here I sit. So yeah, it definitely gave me the view of nursing from the ground up, so to speak. And at every level of it, I liked it. And there was never a time that I walked into a room and said, "Oh, I can't stand this." And it's not to say there has been times that I walked in the room to say, "I wish I was doing something a little different." But you put the patient in the center and you go, "But this is what this patient needs,"
Yeah.
and it
Yeah.
guides everything else.
Yeah, 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 yeah. And I love that a couple of times as you were telling me that a couple of times you said as a volunteer, um, it fed your soul. And I
Yes,
love that you said that. But even at that age, you felt that
right.
thing. You
Yeah,
felt
it was
that thing.
that
Hmm.
connection to, I really, when I go in here, everything else disappears. Right? Any problems that I might have, the test that I was going to fail at school, or the little boyfriend that I wasn't treating me like I wanted to be treated, as you were coming up as a teenager, all those things didn't matter. And oftentimes I could have conversations with some of my older patients because, of course, as a volunteer, they love for you to go sit with some of the elderly that really need that
Yeah.
connection. So
Hmm.
I would sit with them and have conversations with them, and they would give me great advice and all kinds of ideas that really I would walk away, and later on in life, those voices come back to you, right? Maybe when
Yes.
they're saying it to you, you think, "Oh, okay,
Yeah.
yeah, Miss Johnson's just, her dementia, whatever." But then as you get older, you remember some of those things and you think, oh, wow, they really spoke into my future. And I
Yeah.
did not even know it. So, yeah,
Yeah.
I didn't get financial payment, but I definitely got compensated for my time.
Yeah. 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 And you said that you went from the bedside, basically from the bedside to pretty much the boardroom.
Mhm.
What kind of areas did you work?
Well, so I've done everything in nursing with the exception of emergency medicine, honestly. So I have worked mental health, research, drug and alcohol abuse, rehab, and all of the rehabs, whether it was head injury, orthopedic, what have you, med surge, men's health, women's health is my current practice, and the practice that I truly love and always knew I wanted to go into. Um, but I started out and spent the first 10 years of my practice bouncing around. I was very fortunate that bouncing around, a lot of it was all in one facility because I worked for a hospital system that was a very large system in Texas. And they had this program that at that point was brand new and hot, right? Because I've been a nurse for 34 years, going on
Mhm.
35 in a few months here, and they let you float. If they wanted
Mhm.
float nurses throughout the
Mhm.
hospital. And that was a new concept at that time because typically you would be assigned to a unit and that's all you
Yeah.
worked. But they had recognized that, the ebb and flow in the hospital, sometimes you'd have more staff in one area and less patients, and you needed them in another
Mhm.
area. And so I was working for the hospital at that time doing the long term care pediatrics. And I seen the sign come out saying, hey, they're going to open up this float pool. So I went, well, what is that? And so I went to go and investigate it. And basically, they were saying, you're going to work your shifts, but you'll call in the mornings, 4:30, 5 o'clock, and you will get assigned to a unit. And I thought, oh, so you don't know where you're going to work every day? And no, you don't. And wherever you get assigned, they will make sure that you have the skill set to be able to do the work. If it's something that requires some type of specialty, they'll partner you with somebody that can do the parts that you can't do. But, there is a such thing as general nursing.
Mhm.
And
Yeah.
so I signed up and said, yeah, let me be the person that gets to float. So I'd call in the mornings and they'd say, okay, today you're going to rehab. Okay, today you're going and working in post-op. Okay, today you're going and you're working in, and I just floated around this huge system and got to see everything.
Yeah.
And it
Yeah.
really served me well.
Yeah. 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 That's that's awesome. You get to learn so much.
Hmm.
And not just about nursing and just about personalities and all of that kind of thing. You
Right.
get to learn so much. Um, and it takes a special kind of person to be able to do that too,
Mhm.
because it means that you have to every single day adjust to different rhythms and
Right.
routine. And
Right.
that's awesome. That's
Yeah,
awesome.
it gave me flexibility. So
Yeah.
I tell people that when I work in chaos, because sometimes this wonderful field of ours can be chaotic. And so I
Yeah.
tell people when I work in chaos, I can always find my center because I started out with something like that. And so it's just like, what is the center thing that I have to do? And people that have worked with me will tell you I'm classic for saying I put the patient in the center. There,
Yeah.
that's my center. So whether that patient is there because they just had surgery, because they have cancer, because they fell and broke an arm or a leg, whether they're 15, 50, 75, 26. there's still patients in need. And that core of that then guides what I need to do. And if there's something that I run into that I just don't understand or don't know, then I need to go and ask for help. But being able
Mm-hmm.
to nurse them, I
Mm-hmm.
can always do that.
Absolutely, absolutely. So now you are in education. You're an educator, yes?
Yes.
Currently. What what would you like to see included in nursing education as it stands now? Or maybe even removed. I don't know.
Oh my. So honestly, I think with nursing education right now, because nursing has the shortage that it has, we're pushing hard to do more in less time, much like everything in this country right now. Everybody wants it, they want instantaneous. I think
Mm-hmm.
the invention of the microwave changed the way that we thought about things, right? Once you didn't have to labor over getting a meal anymore,
Mm-hmm.
people were like, well, why can't everything be instant? And so that's kind of how we move through the nursing programs now. And so we have a lot of opportunity to be able to fill their cups after they finish up. When they get out of school, the schools are really pushing them to be able to pass NCLEX. That's the gold standard for the school, right? It's not that you necessarily are going to go out and be able to be a wonderful nurse at the bedside. It's a secondary. That's the secondary thought. But the gold standards for the school is that you can pass NCLEX because that is how they keep their accreditation.
Mm-hmm.
So you can
Mm-hmm.
be a wonderful person and have a lot of compassion and fail NCLEX, and the school does not get any credit for what they poured into you. You cannot be a wonderful person and your compassion can be minimal, and you can pass NCLEX with flying color and the school gets yay, right? So, what do we do in order to be able to get those two things combined? Because while we want nurses that can pass NCLEX, absolutely, we also want
Mm-hmm.
them to be able to get out there and be compassionate and care about the human condition and take care of patients without judgment and all those things that we know go along with nursing. How do you put those two things together? And so I think one of the things that we have an opportunity when it comes down to educating our new nurses is being able to build that foundation for them. Yeah, they have NCLEX, but when they get out here and they start working in these hospitals, you got to give them the time to build that. And the hospitals want them to hit the ground running, right? So they
Yeah.
have no desire to build any of that in them. It's like, do you know how to follow an order, and do you know how to give a med? Do you know how to
Yeah.
keep your patient safe? Okay, here you go. But
Mm-hmm.
it becomes very robotic, and I think that's a lot of what our patients are seeing now when we think about you know HCAP scoring and the patients and what they say about what they're experiencing.
Yeah.
They have are losing that touch from the nurse, that
Yeah.
sincere touch. They came in, they did what they needed to do, yeah, but right, I didn't feel like they were warm and fuzzy. I didn't feel like they cared about me. I did that kind of thing. And
They
that
didn't
really
even
is the
see me as a
core.
person. Mm-hmm.
Yeah. When you think about what Florence Nightingale was doing when she decided to try to design this passion, she didn't go in and look at it from a scientific standpoint. It was very much so an art.
Yeah.
And so the art of nursing, we've got to make sure that we keep that as we become more scientific, and we have to be because patients are getting sicker. So we do have to have that scientific part, but you have to have that human compassion, that moment of being able to connect with people and make sure that they're okay.
Yeah. 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 And that is a bigger thing than just about anything else that you can do.
Right.
So, given all of that, though, given all of that, what advice would you give then to someone who wants to be a nurse?
Oh, I tell students all the time, definitely do it. there's, I don't think there's a better profession on the planet than nursing, honestly. And I know I'm biased, but I really, really encourage people, if you want to make a difference in the world, if that's what you're looking for, if you want to be able to take care of people, then nursing is definitely the thing that you need to go into. And my biggest advice to them is walk in with your eyes wide open. On the days where you get discouraged, make sure that you journal. On your days that you're happy, make sure that you journal, because that's going to be the thing that's going to keep you focused and centered. I have little notes that I've written for myself over the years because I wasn't smart enough when I first started this thing to have one journal book. So I just have these little notes that I've written or that my patients have written to me, and I have a memory box that I keep a lot of little things in. And some days when it gets to the point where I'm wondering what in the world, um, I'll pull it and I'll start reading through it. And I can
Yeah.
remember, oh, this day was a day that I was really excited, or this event occurred and I really enjoyed that event. Oh, this was a day that I felt down in the dumps too, but look, I made it through, right? It really helps you to be able to guide you through what you have to experience. So I
Yeah.
highly encourage journaling for all of my students.
Yeah. 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 So what are some of what I know is that there are some misconceptions out there about nursing. What are some of the misconceptions you've encountered?
Misconceptions. So I think the number one misconception that I hear people say about nursing is that we are handmaidens, that we don't really
Mhm.
have a knowledge level.
Yeah.
We are task doers
Yes.
and not necessarily thinkers about the
Hmm.
process. And
Hmm.
in my field, especially because obstetrical nursing, labor and delivery specifically, has so much autonomy that
Hmm.
oftentimes when we are working with the patients, I'll hear the family member say, "So where's the doctor?
Yeah.
You're doing all this? Where's the doctor? I thought the doctors did this. I thought, and I, very nicely will say, well, yeah, the doctor's going to come in when I call and let them know.
Hmm.
Right. And that is always an aha for them because they come to understand that, yeah, no, this is the nurse. You walk in the door, I'm gonna be the person taking care of you. I'm gonna call your doctor and let them know what I see. They're gonna give me some orders, and I'm gonna be the person implementing those orders. And then I'm gonna call them and let them know it's time for them to come and see you. They're gonna come see you, and then they're gonna give me some orders, and I'm gonna do the stuff that needs to happen. And it's never a situation where I am not needed to be able to make your process happen.
Yeah. 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 That's very nicely put. So with all this technology, Um, as I look back, you just told me a while ago that you're almost 35 years in. I am, 50 years in. As I look back, I see so many changes have taken place in nursing, and particularly in the last 5 to 10 years, it's like exponential. When you look ahead, how do you see technology influencing the way we deliver care, and how nursing works?
So I think technology is going to continue to develop. I don't know that we have any control over that. And I foresee that, you'll probably end up with patients interacting more with a screen than they are with the human nurse.
Yep.
It's going to be much easier for you to have one nurse taking care of 10 patients that are healthy enough that they can tell you what's going on. And
Yeah.
that nurse can sit at a screen and just buzz in, hey, Miss Johnson, so, how are you feeling? What's going on? Can you please place your arm into the cuff? Let me get your blood pressure now, right?
Yeah. Yeah.
So that is where I see this eventually going as a human condition gets more and more used to technology and more reliant upon it. I think that it will start to replace um, us being able to interact and touch and talk with each other. And there's
Yeah.
good and bad to that, right? It's
Yeah.
not all
Yeah.
horrible. I definitely see the ability for people to get more appointments and to be able to be taken care of maybe in a more rapid fashion
Hmm.
because not everything requires you to have to take the 20 or 30-minute drive to your doctor's office to be able to be seen. It doesn't all require you to
Yeah.
have to have the nurse come in and talk to you first and then the doctor to come in and talk to you, or a hospital stay. It doesn't always require that. Sometimes things can be resolved with a look on the computer.
Yeah. Yeah. And I foresee also that as we talk about this nursing shortage, real or perceived, that we will bring more technology on board to attempt to compensate for this,
Yes.
which will, in my view, accelerate the use of technology in the way we practice. But how do you feel then about the security of all of this?
Well, anytime you put anything out on the World Wide Web, your security
Yes.
has to be in question. And so it's probably because of my generation that I will make this next statement, but I am more comfortable with my private things being locked in my mind or the mind of the people that I share it with than I
Yeah,
am with it being locked into a computer. Because at that point, I feel like anybody that can hack it can access it.
yeah,
And so that does give me cause for caution. And I think it will for other people as well, because I have to believe, based upon what I know about um, human beings, that somewhere along the way it will get exploited. So, because of that, you will have people that are saying, I don't want to go because if I go to the doctor, as soon as they
yeah,
put it in the computer that I have this disease, that disease, or that I had this complication,
yeah,
everybody's gonna know,
yeah,
right?
exactly.
So I definitely see that as being a problem with
Yeah,
technology.
yeah, yeah. And it's not even there is, as you mentioned hacking, but there isn't even also the other thing is that healthcare today is very much a business model.
Right.
And as one business takes over another business, for example, the way they deal with what they took over may very well be different. And so, what you're exposed to and what your information is exposed to and how it's disseminated may very well be different. So,
Well, and because so many people in the technological world understand so much better than those of us that are not necessarily tech savvy, the way that things merge together. And so
mhm.
the use of your health information has a value. It has a
Yes,
value. They can sell
yes,
what they know about you to people who want to advertise products to you to
mhm.
improve you or to
Yes,
make you feel better. So that value then makes that data be very valuable. And
yeah,
that's why having it out there, people want to hack it or they want to get access to it so that they
yes,
can use it to be able to make money, not
yeah.
necessarily to your benefit,
Not
to,
necessarily
but
to
to
your
make money.
benefit. And even things like you're seeking insurance,
Mhm.
uh, you're seeking a new job.
Right,
All of those things, people can at some point, the bad actors
right,
can actually utilize those things
right.
for that. So what do you do? We talk a lot these days in nursing about burnout. I see a lot of things about, nurses leaving the bedside, nurses stepping away from the profession because they're burnt out and all of that. And the reasons that people give are really they're valid. They talk about things like shortage of staff, more work, less, with fewer things, fewer resources and things like that. But I do think that some of it comes from the way we treat ourselves too, and the way we are conditioned to treat ourselves, or where we put ourselves in the equation of things.
Mhm.
So, what do you do to take care of you?
So, years ago, I learned the hard way that not having compassion for myself and taking care of myself um, made me not be as good of a person as I needed to be for everybody else. I learned that rule about, you got to take care of yourself first, or the
Hmm.
airplane rule, give your
Hmm.
own self oxygen before you give it to anybody else.
Yeah, yeah,
And I learned it the hard way because I ended up not taking care of myself and was running so hard trying to be at what I call the super nurse syndrome. And I tell young nurses, you got to watch out for the super nurse syndrome, and then found myself needing medical attention. And it was just because I had just run myself ragged. So
Mm-hmm.
I promised myself, and I was a young woman at the time when it happened, and I promised myself to my future self that we would not have that be the situation, that we would take vacations on a regular basis, that we would make sure that we had some type of outlet. And so over the years, I've had a lot of different outlets. Currently, yoga is my outlet. I
Mm-hmm.
am an avid yogini. I start my morning every day with meditation and yoga movements and things of that nature. I have a shirt that one of my instructors absolutely loves every time I wear it to class, and it says, I bend so I don't break. It really is the rationale for why I do what I do with yoga. But it really helps to feed me to be able to do that. I make sure that I keep myself monthly appointments that make me feel good, right? So
Mm-hmm.
I nurse myself, uh, a massage, a trip to the spa, to have a facial or something of that nature. I take my vacations scheduled. I never allow myself to work more than 6 weeks straight without having a day down.
Mm-hmm.
And it doesn't
Mm-hmm.
necessarily have to be a day off. I just need a
Yeah.
day down.
Yeah.
That's
Yeah.
especially now working in education. Um, when you start going into the academic area, that's 24/7.
Yeah.
Not necessarily because there is a class going on, but just because there's opportunity for you to do something. It's very
Yeah.
simple for me to sit in my office at home and be lost in work for 12, 13 hours. There's always something to do. There's
Yeah.
always a paper to grade, a new syllabus that I
Mm-hmm.
want to write, a new
Mm-hmm.
idea that I want to explore in class, a new way to teach something. Um, so I could definitely work all of the time. And because I love it so much and have such a passion for it, oftentimes I don't even feel like I'm working, right? I'm enjoying what I'm doing.
Yeah.
But then I have to say to myself, you got to get up. You got to move around. You got to go
Yeah.
see other people. You got to walk out the house, walk out the office, right?
Yeah. Yeah.
Like you have a
Right.
whole house on the other side of that door. But you definitely have to tell yourself to make sure you have balance. And I think the real key here to all that I'm saying for that burnout is that you have to balance it out. You cannot have yourself always so deep into the trenches. And because of, I like you said, the perceived nursing shortage, I love that because I
Mhm.
definitely believe sometimes it's like, is there really a shortage? Is that really what's going on? Are we misusing the resources that we have? Yeah, yeah, definitely feel you on that one. But I think oftentimes because of that, people feel like they have to do so much more, have to do so
Yeah.
much more. I
Mhm.
worked leadership for years, and I will tell you that in working leadership, I most definitely had to mind myself because it was relentless. It
Yeah.
was never ending. Even going on vacations did not get me away from it because I can tell you numerous stories about being on vacation and answering the phone to manage something that was on the floor,
Yeah.
getting my laptop out to do payroll while on vacation, and all of those types of things. And so, although I was taking my time away from the office, I wasn't taking my time away from the job.
Yeah.
And so that was a new level for me because I thought so long as I was taking my time away from the office that I was going to be okay. But it taught me that no, because you're still not taking a
Yeah.
break, you're still not breaking away. So I
Yeah.
had to learn how to pad myself and protect myself from that. So you just have to have balance. You have to make sure that no matter how much is going on, that you remind yourself that you too are human and you too are fallible, and you've got to have some downtime to have resiliency.
Yeah. 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 And I love when you started to answer that question. One of the first things you said is that you tell your students that they have to. I don't remember the word used, but you tell your students they have to take care of themselves.
Yes.
Um, and basically that to me is huge because that is not something that was normally done. I for certain know that I went through the whole of my own nursing school and way into my nursing career before anyone ever said, actually, I don't know if anyone ever actually said that you've got to take care of you, right? I finally learned that.
Mm-hmm.
But the way that I was educated was you've got to take care of everybody else. This is your responsibility.
Right.
right?
Sacrifice,
And
sacrifice,
it was
sacrifice.
overt and covert, that message.
Mm-hmm. Mm-hmm.
Yeah.
Very true. And it's a sacrificial type of a thing. And
Yeah.
that's so you just give until you're all given out. And then, oftentimes you get swept away. I've seen it in my career where I've worked with people. There's one in particular that always sticks out to me, and she was the director for the length of stay. It's not what it's called, but that was her big project. Was trying to manage um, the case managers for length
Hmm.
of stay on the hospitals, and she was relentless about it. They were always on her because, of course, length of stay translates into dollars for the hospital.
Hmm.
And one day she didn't come to work, and we were all shocked because she was always there. It's like she's never takes off. What happened? What happened? And we learned throughout the course of the day that she did not make it out of her bed that morning, that her family had found her in the bed, unresponsive. And later on, we found out that she'd apparently had a stroke, was hospitalized in the ICU. They got her back and stable, and then she had another stroke, and she ended up losing her life. And I remember working for the facility at that time, and we were all kind of talking about it and talking about, how we got here with her and how she had been so giving and doing all the things that she was doing and all the long hours that she was keeping. And the CEO made an announcement and told us, all the leadership team are going to gather and we're going to have a memory service. And he literally gave us like a 2-minute spiel, had us take a moment of silence, and then it turned into a meeting to talk about how we were going to move forward with length of stay now that she was gone. And I walked out of that meeting thinking to myself, her son was getting ready to have his first child. She'll never see her first grandchild. All the things that she's going to miss. And they gave her a total of 3 minutes
Yeah.
to
Yeah.
be able to say, so sorry. And I said that it wasn't worth the sacrifice. It was
Yeah.
not worth the sacrifice. She could have definitely been able to take better care of herself. Now, I don't know what her health condition was. I
Yeah.
don't know if she had other things that were going on that may have led to the stroke that she had. But I know 100% that the hours that she was putting in and the stress that she endured trying to do the job that she had been tasked with didn't help her situation.
Yeah.
And
Yeah.
I walked away from that with, I will not do that to myself. So when I find
Exactly.
myself being inundated like that, and I feel like it's overwhelming, I have no problem with saying, okay, time out. That's it.
That's it. That's it. That's
I'm
it.
going to fall off the field. Right. And if that means that my employer cannot respect that and says, well, listen, if you can't come to work, then, you can't work here. I'm okay with that. I'm a
Right.
nurse. I'm a
Yeah,
nurse.
right.
There are 15 other jobs out here that I can go and get. But what I will not do is sacrifice me because my family deserves better than that. I deserve better than
It is.
that. And so that's not something that I'm willing to do. And you'll replace me, whether you replace me because I don't come in when you want me to, or you replace me because I end up hospitalized because I came in when you wanted me to. You'll replace me.
You replaced me. Yeah. Yeah.
Yeah.
Yeah. And that is a I was going to say was, but maybe that is still it's so intrinsic
Mm-hmm.
in the profession. But don't when you don't do when you don't go the extra mile or the extra 2 mile, and people are like, well, what's wrong with you?
Right.
You're not a team player,
Right.
or I'm part of the team. Part of being a team player is that I have to be loyal and true and trustworthy to myself.
Right. Right. And honestly, I think this generation will fix that.
Yeah, and I
Because
love it.
this generation loves themselves. They absolutely love themselves and they love spending time with themselves and they love doing stuff for themselves. And they are not readily willing to sacrifice
No,
their time
no.
alone to be able to do for somebody else. And there's good and bad to that, but I'm just saying they will not end up being a generation that's going to make that sacrifice because they're just like, hey, listen, sound like a
Yeah,
personal problem to me. You don't have enough
yeah.
staff. Well, it's my day off.
It's my day off. It's my day off. And you know what? I think we can take credit for them feeling that way. Unwittingly, we taught them that this is not the way to go.
Right, right. Just as our
So,
parents unwittingly taught us that it was the way to go, right?
yes.
Right. 'Cause I don't think that I ever had a conversation with
Right.
either my parents or the older people that were around me to say, you have to sacrifice everything and you have to.
No,
What I
no.
did was I seen how they acted, how they
Yeah,
responded. I seen
exactly.
how things got postponed. Oh, I can't
Mm-hmm.
make it to your recital because I got to
Mm-hmm.
go to work. I can't
Yep.
write. So what I learned was you got to work,
Yeah.
and work has to be done because that's how
Yeah.
you pay your bills. And if you don't do what you need to do, then you'll lose your job and you'll lose
Yeah.
everything. You have to
Yeah.
sacrifice everything in order to be able to make sure that you keep everything.
Yeah. Yeah.
And yeah, I'm with you. I did not do that to my children. I always adjusted my job around
Mm-hmm.
my kids. And I would always tell people, I have my job for my kids. I don't have my kids for my
It's
job.
for your job.
So
Mm-hmm.
I am going to make sure that I'm there when they have football games, when they are doing whatever it is that they're doing. I am going to be there. And if that means that I can't come into work, whether it's a call out, I get so many of them before you write me up, so I'll use them strategically, right? or if or if it is that I have to take some PTO time,
Yeah.
I have got to be able to make sure that I am there. So
Yeah.
yeah.
Yeah, 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 yeah. Heretha, this has been a great conversation. I've loved talking to you. Any
Thank you.
last words before we go?
I just think that this is a wonderful thing. When you reached out and I understood what you are doing with this podcast, I thought, what a phenomenal idea. I think that nurses just are in the background and have
Yeah,
been for years. We don't get enough credit for what we do because
yeah,
people really don't understand it. I think the greatest gift that we do get on a regular basis is being the most trusted profession, right? When that Gallup poll comes out and they go, oh, nurses are so trusted. But we're kind of the silent partners. And
yeah.
so I appreciate that you are giving us a voice and allowing us to be able to express that this is what it's like to be a nurse. I think that we definitely need that. There's no rewards coming for this profession, right? And we do so
Right?
much. There's no annual any soiree on TV to talk about who was the wonderful best
Yeah.
nurse or anything of that
Mm-hmm.
nature. There's not even a way to be able to measure it.
Mm-hmm.
Right?
Right.
So how would you be able to do that? Because you
Yeah.
really can't measure it out. But we as nurses do recognize what it is that we sacrifice. So I appreciate you recognizing it enough to say, you know what, I'm gonna create a platform for us to be able to have that conversation. I think this is really great, and I wish you all the best success as you continue to do this.
Thank you so much. Thank you so much. I want to highlight nurses, so thank you so very much for saying that.